Hi, my name is Jill Shuttner, and I had my breast reconstruction surgery done at Penn Medicine, Princeton Medical Center. I felt something myself in my breast, and I wondered what it was. It bothered me enough that I sought out treatment, and the doctor did have me go for an ultrasound, which then led to a biopsy. General doctor introduced me to Dr. Crivello. I met Dr. Crivello, and she diagnosed me with invasive lobular carcinoma.
When she came to see me, she had this very large mass on the right side. It was very close to her skin, and I felt a very big, what we call a lymph node in her right armpit area. And so all of these things were very concerning for a very large right-sided breast cancer. One
of my questions as they were preparing my treatment plan, I was extremely upset that my son, my eldest, was graduating from college in December, and that I was already going to be on chemo and would not be able to attend. And both my oncologist and Dr. Crivello assured me that I can go to this graduation. And I was fortunate that I hadn't lost all my hair. So when I went to the graduation, I still had my long hair, and I was able to enjoy the entire weekend with my family who came in while I was on chemotherapy. And it was just a really nice gathering of everyone at a very difficult time.
She felt much, much better after having a plan to go forward and knowing that she was in very, very good hands here in Princeton.
I did seek multiple consults to find out more about my options, but only one offered me an option where I would not have a breast implant. So I met Dr. Katzel, and he provided this option, which I knew nothing about.
Jill is a very nice woman who unfortunately had breast cancer, and she was going to require post-mastectomy radiation. You know, the data would show that, and research would show that her best option was to have a free flap.
I know a lot of people, and they've all recovered very, very well with implants. It's just that when I heard that I didn't have to have a foreign object in my body and I could use my own tissue, that intrigued me, and I really liked that option more than anything.
The free flap reconstruction, or where the reconstruction where I use your own tissue, is a much better option for her.
When someone needs radiation after her surgery, and also her nipple and areola, because they were involved with cancer, they were going to have to be removed as well. So she was actually a perfect candidate for free flap.
I do a specialized procedure for breast reconstruction where I take the tissue from your abdomen, and the tissue that would be thrown away during a tummy tuck or an abdominoplasty, and I trace the blood supply to that tissue, and I harvest that tissue on its blood supply, and then I reconnect that blood supply to the blood supply in your chest, so that instead of having a foreign body, you have a breast reconstruction using your own tissue, and that's living tissue. So as you age, it ages with you.
So my first treatment was chemotherapy. I had chemotherapy for 4 months. It was every 2 weeks. I met with Dr. Blum.
She had a good response to her chemotherapy, and it made it easier for us to operate down the line. So I am doing the surgical oncology part of it. I'm up at the top removing the cancer, doing the mastectomy, doing whatever I need to do with the lymph nodes. Simultaneously, the plastic surgeon, in this case, Dr. Katzel, is starting the free flap down in usually in the abdomen.
The benefit of working or taking the tissue from the belly is that while Dr. Crivello is doing the mastectomy, and, you know, if you need a sentinel lymph node dissection done, anything Dr. Crivello is doing, I can work in the belly at the same time and harvest the flap at the same time while Dr. Crivello is working. And then when she's done, I can go and prepare the vessels in the chest and then move the flap up into the chest. So in terms of, it's a lot of surgery, but there's a lot of surgery happening at the same time. So it's not like it's one surgery and then a second surgery in series. You've got surgeries going on in parallel,
which is fantastic. It's fantastic for the patient, both physically and emotionally, that they can be, they have their cancer removed and be reconstructed at the same time.
So after the surgery was complete, it is a 3-day recovery period at the hospital in ICU. So you're heavily monitored by the nurses and the doctors while you're there. And there was a very structured plan of my recovery. They did tell me it would be approximately 3 to 4 weeks, the recovery period, and they were pretty close. My surgery, my mastectomy and reconstruction was done in April, the very end of April. I went in for the nipple reconstruction in November, early November. And at that point, I was feeling great, really good. So I went in, I decided that was enough time for me to go in for the nipple reconstruction. At the same time, since I only had a right side mastectomy, they did do a lift on the left side to make sure that I was evened out, if you will. I am 54, so they did do cosmetic to make it appear even. So that was the same day. I did not spend the night surgery, so I was home that night. Recovery was not too long. Within weeks, I had recovered. I went on vacation in December, so I was fully recovered within a month and off, enjoying my life.
Yeah, so I've seen Jill multiple times since her surgery. She's doing fantastic. She's comfortable. She's back doing her regular activities. She's doing great. We actually have something in common. Both of our sons play hockey, so we talk a lot about that.
I had the best experience from the start to the finish. I definitely would recommend Princeton Medical Center, Dr. Cravella, Dr. Katzel, all of them, the whole team of oncologists, everyone.
Breast reconstruction or breast cancer care is really, and especially at Princeton, we have a great team, and it's really a team effort. So Dr. Cravello and Dr. Doltz are excellent breast surgeons. They're really, really good at treating cancer, and they treat patients really well, and that allows me to do my job really well.
They were a tremendous team, and I honestly hope that other women who experience this have the same experience that I had, a positive experience. And that's really what it boils down to. It's in the past now. It's something that I have moved on forward from. It doesn't define me, and it doesn't hold me up. I'm going to keep going, enjoy my life, and I think my families were all able to enjoy it again. So that's the plan.